I practice in a part of Kerala, Kasaragod district, which is a small town. I do get a mother bringing her daughter, kindly get a virginity test for my daughter. Or as a doctor's perspective, നമ്മുടെ OPയിലെ ഒരു കുട്ടി വരുമ്പോൾ we don't judge them, and there is nothing called as a virginity test.
Why vagina need to be get tightened?
As a couple, they will not be having the same sexual gratification or satisfaction as prior because the vagina has got laxed. It's kind of, I cannot put it as cosmetic, but I can put it as more sexual discomfort or dysfunction.
Is it possible to have a child after vaginal tightening? Will it affect their sexual life?
There are so many girls by birth hymen undavilla. Sometimes after delivery, 2 deliveries, 3 deliveries, 4 deliveries, 5 deliveries or n number of deliveries, the vagina gets lax, and that's when we bring it back to a 2-finger vagina, which means pre-pregnancy or a pre-delivery vagina. Is it cosmetic gynecology maatrano? It is bangi kana mennittu maatrano ennulladu is the first common myth what you can call it as.
Is there a separate branch, a cosmetic department for males?
Being a gynecologist, it's difficult for me to answer. You are a better person for that to answer.
Dr. Shruthi, welcome to CheersFit.
Thank you.
What is the difference between a normal gynecology and a cosmetic gynecology?
The work what we do as a gynecologist and a cosmetic gynecologist is a little bit different, that's it. But more of, we introduce a lot of cosmetic treatments in gynecology. Probably complaints, probably every gynecologist will be having in their day-to-day OPDs, all these complaints, whatever we see as a cosmetic gynecologist. But the approach to it is a little more finesse and a little more aesthetic is what I can put it as.
Is cosmetic gynecologist really a boom in India right now?
Yes, kind of, because people are getting aware of their aesthetic appearances of their gynecological anatomy or the external genitalia, and people are accepting quality of life to a great extent. The famous tagline now it goes, it's the 40s is the new 20s. So in that way people are coming out with those concerns. So when you are getting those patients, obviously it's a doctor's responsibility, I can put it as, that to treat those conditions or make them comfortable or make them satisfied with their complaints and the treatment options available. So in that way, when the concerns are coming to us, it's our responsibility to keep ourselves updated, and in that way cosmetic gynecology is coming up because trend is so that complaints are increasing in aesthetic wise. So in that way cosmetic gynecologists are coming up.
Cosmetic gynecology എന്ന് പറയുന്നത് സെപ്പറേറ്റ് ആയിട്ട് ഗൈനക്കോളജി ആസ്പെക്റ്റിൽ നിന്നും വളരെ ഡിഫറെന്റ് ആയിട്ടൊരു വിങ് ആണോ, ഓ ആർ ദേ always connected to gynecology?
No, it is not a separate wing at all. It is always connected to gynecology, but we are taking different departments ka treatment options into gynecology. Like for example, we do take dermatological aspects, we do take plastic surgical aspects, we do take urological aspects. So idella combine aayittu cosmetic gynecology we are studying more probably, and we are treating more of a complaints, to be frank enough.
കോസ്മെറ്റിക് ഗൈനക്കോളജി എന്ന് പറയുന്നത് കോസ്മെറ്റിക് ബെനിഫിറ്റ്സുകൾ മാത്രമാണോ, ഓർ ഈസ് ദർ എനി ഹെൽത്ത് ബെനിഫിറ്റ്സ് ടു?
No, definitely. That is actually cosmetic gynecology or an aesthetic gynecology is a misnomer, I can put it as. Because almost 50% of them is more of a functional, more of a complaint oriented and more of a reconstructive, pathology is what we treat. So in that way, it is, I can put it as partially cosmetic, partially reconstructive or more functional concerns.
Like it is more like a 50% cosmetic approach and a 50% reconstructive approach.
True. Correct. That's what.
So which are the age groups that you take care of?
To be frank enough, cosmetic gynaec is coming up in every age group, because younger age group or adolescent to early 20s age group we see a lot of PCOS concerns, body changes, and other day ആയിട്ടുള്ള ഒരു aesthetic രീതിയിൽ കൂടുതൽ complaints ആയിട്ട് വരും. Comes to mid age കുറച്ചും കൂടി ഒരു വെജൈനൽ ലാക്സിറ്റി ഇല്ല ഒരു പോസ്റ്റ് പ്രഗ്നൻസി ചേഞ്ചസ് ആയിട്ട് കൂടുതൽ ഏജ് ഗ്രൂപ്പിൽ വരും. and a little more like 40-45 ആകുമ്പോഴത്തേക്ക് ഈ മെനപ്പോസൽ പെരിമെനപ്പോസൽ ഏജ് ഗ്രൂപ്പ് ലൈക്ക് vaginal burning, SUI, stress urinary incontinence, അങ്ങനത്തെ complaints വരും. So there's no particular age group who comes to us. It is from adolescent to a little older age group also we deal with.
Doctor, what are the aesthetic treatments which are currently available in cosmetic gynecology?
Okay, there is quite a long list of aesthetic treatment what we provide. I'll be more precise to the gynecological aesthetic part of it. As I told you, younger population vararundi. So these things starts most commonly what we get patients is of the patients from PCOS and other day related ulla cosmetic concerns like they will have hair loss commonly. They will have neck pigmentations, okay, and any like underarm pigmentation, perineal pigmentations, pigmentations undavu. Then we also have facial hair growth, like scalp hair loss undavu, face hair growth undavu. So these are the male pattern anna parayu. So these are the concerns what we get. And aesthetic treatment wise varumbolu hair loss definitely we do sometimes treat as a basic level and sometimes we do refer to a dermat. And then coming to the facial hair growth, PCOS and we also have a holistic approach, hormonal balance plus the cosmetic treatments. From starting from hair loss to facial hair. Hair loss nammal chelappo oral medications kodukku for the hair loss koravakana, newer hair growth varana. And then we do have PRP treatments for hair loss. And then coming to the facial hair, we do have a combined medical management along with it. We do have purely cosmetic treatments like laser hair reduction. That is laser aayittu nammal hair ne reduce aaki teru. It will be like a sessions of treatment like monthly one sessions depending on the thickness of hair, depending on the density of hair. Adade athre sessions aayittu nammal advise cheyyarundu, provided our PCOS also isn't associated with it, treatment is associated with it. So then coming to her pigmentations, we do have chemical peels for her pigmentations. Neck pigmentations ആയിരിക്കും, armpit inde ആയിരിക്കും, perineal pigmentations ആയിരിക്കും. ഇതെല്ലാം നമ്മൾ chemical peels പറയാറുണ്ട്. And not only PCOS, directly നമ്മൾ cosmetic treatment എന്ന് പറയുമ്പോൾ underarms inde laser hair reduction ഉണ്ട്, perineal hair reductions ഉണ്ട്. So these two hair reductions is coming kind of a private parts എന്ന് പറയാൻ പറ്റൂ. So അങ്ങനെയുള്ള സമയത്തിൽ chemical peels ആയിരിക്കും, laser hair reduction ആയിരിക്കും. More so of a perineum comes to a gynecologist. So perineal hair reduction is not only cosmetic, like as you were asking, cosmetic ആണോ function ആണോ എന്ന് പറയുമ്പോൾ, so it is kind of a functional also. ഇപ്പോൾ recurrent ആയിട്ട് razor യൂസ് ചെയ്യുമ്പോൾ pigmentations കൂടും, recurrent ആയിട്ട് razor യൂസ് ചെയ്യുമ്പോൾ infections വരാൻ തുടങ്ങും, folliculitis വരാൻ തുടങ്ങും. അങ്ങനെയും നമ്മൾ sometimes not as a cosmetic but as a functional aspect, as a treatment aspect നമ്മൾ laser hair reductions പറയാറുണ്ട്. So these are the common peels. Perineal hair reduction is a common treatments what we come across.
Okay.
And then we have kind of surgical options also.
So what are the common myths or the misconceptions in cosmetic gynecology?
Myths എന്ന് പറയുമ്പോൾ as you firstly asked, is it cosmetic gynecology മാത്രമാണോ, it is ഭംഗി കാണാൻ വേണ്ടിയിട്ട് മാത്രമാണോ എന്നുള്ളത് is the first common myth what you can call it as, that it is not cosmetic, it is more so 50-50 I can call it as. And another myth what I see is if you undergo any cosmetic gynecology treatment and you will be all trim and all good to go and all like a fantasized picture kind of a thing. So that's also not true. So we all, being a doctor, we try our best to give you your body related best perfection of it. You cannot call there is one, you cannot show a photo and you cannot tell that I have to become like this, because your body is different from a photograph what you can carry with you. So in that way, the myths of unrealistic expectation has to be brought to a realistic expectations.
Is Indian woman really confident enough to talk about their sexual issues to a doctor?
Now I can tell that this trend is changing. When I started my practice back then, it was a little bit too much of a taboo, and it is still a taboo to open up about their cosmetic gynec anna parayumbolu almost a functional verumbolu, so most of it is a kind of related to sexual dysfunction also. And when it comes to their private parts, when it comes to your sexual health, they are a bit hesitant to open up about it. And comparatively now people are a little bit more comfortable and they are more open about it, compared to prior years. And but yes, there is a long way to go, and people still are hesitant to tell 100% of their complaints. And once you get into their comfort zone, when as a doctor we get into their comfort zone, only then they clearly open up. But coming and just sitting in front of you and opening up about a complaint is still a little bit difficult for the Indian girls.
So how do you deal with these things?
Yeah, as I told you that, once you realize, sometimes I do have a questionnaire in my OPD. When we realize that it is a sexual complaint, we give them a questionnaire in hand. So when they are waiting for my OP, so they fill those questions, So I will have an idea of what directed questions I would, what she is expecting, to get cleared from me. Or she will also have an idea that, I have put, part of my complaints in a paperwork way to the doctor, so that doctor will know what I have coming from. I don't have to beat around the bush and come around, what the complaint is. So it is a little bit of, getting into the ease of the patient. So, and once you are in that comfort zone, I have seen patients open up to you. Once you feel that, doctor is a little convenient, I can open up about my personal complaints to her, and they do open up. So this is one small way how I tackle it in my OPD.
So, doctor is only one person who we really need to share our things, right?
No, that's the one sentence I tell to my patients. Like, see, you have come with these complaints, probably with your partner you might share, but nobody else these complaints can be shared with. As a doctor, we don't judge you. We find, when you are telling a complaint to us, we, in our mind, what runs is, how can I help this patient in, how can I help this girl in treating this concern of her? So that's how our mind works, and not in a way that I'll be judging her. So that comfort zone, when the patient realizes, they open up to us.
Do you ever feel the expectations of the patients are really high?
Sometimes I do feel, when it is more so of a sexual discomfort, when they come as a couple. Okay, they do come as a couple, and sometimes when it is a sexual dysfunction, the partner brings the female to my OPD, telling, doctor, she was like this before, or we are not sexually same way as satisfied as prior. So in that way, sometimes they are unrealistic, the expectations are there. So these are the things we try to handle it more finessely.
In India, so we are right now in 2025, but still there is bedsheet or virginity test customs happening in India. What is your opinion on that? Do you ever experience that cases still happening in India?
Yes, I have seen, like I practice in a part of Kerala, Kasaragod district, which is a small town. I do get a mother bringing her daughter, or somebody, we presume it's a mother, get and, kindly get a virginity test for my daughter or for my daughter-in-law, or whomsoever it is. But as a doctor's perspective, നമ്മുടെ OPയിൽ ഒരു കുഞ്ഞി വരുമ്പോൾ, ഒരു കുട്ടി വരുമ്പോൾ, we don't judge them, and there is nothing called as a virginity test. Okay, ഇതെല്ലാം നമ്മുടെ സോഷ്യൽ മീഡിയ എല്ലാ ഒരു പബ്ലിക്കിൽ നടക്കാനുള്ള ഒരു ഡിസ്കഷൻസ് ആണ്. Okay, and when it comes to more medical way, there's nothing called a virginity test, and there is nothing, hymen is something which can be there in a girl, which need not be there in a girl. Hymen is the one, ആ പദം നിങ്ങൾ പറഞ്ഞ term medically is called as a hymen. Okay, so hymen is a thing which need not be there at birth, and can rupture not only with the first intercourse, but it can rupture for many other reasons, like if she is into sports, if she is into horse riding, if she walks faster, if it is very thin, it can just rupture by a menstrual blood. So there are many other reasons why that membrane can rupture, and there's nothing called a virginity test. And now tampons are coming up, menstrual cups are coming up. We as a medical professions, we are promoting menstrual cups to a great extent, because it is hygienic and it is more eco-friendly and patient-friendly also. So in that way, hymen is nowhere in picture in defining a virgin. So angane vechittu, that is just to be stopped, is what we, as a medical perspective.
So can a woman be born without hymen?
Yes, congenital absence of hymen is there.
Oh.
So that is what everybody has to understand, and there is no point in judging a female just because of presence or absence of an hymen or a tear of an hymen. No, that should not be done.
Still there are cases happening. Even കല്യാണത്തിന്റെ അന്ന് രാത്രി ബെഡ്ഷീറ്റിൽ ബ്ലഡ് സ്പോട്ട് കണ്ടില്ലെങ്കിൽ ആ സ്ത്രീയെ കൊല്ലുന്ന കേസുകൾ വരെ ഇന്ത്യയിൽ ഇപ്പോൾ നടക്കുന്നുണ്ട്. സോ ഈവൻ മഹാരാഷ്ട്രയിൽ ഒരു പ്രത്യേക കമ്മ്യൂണിറ്റി ഉണ്ട്. ഇറ്റ്സ് കോൾഡ് കഞ്ചാർബത്ത് ഓർ സംതിങ്. അവിടെ ശരിക്കും പറഞ്ഞാൽ വിർജിനിറ്റി ടെസ്റ്റ് നടത്തും. അത് അവരുടെ ഒരു കൾച്ചറിന്റെ റിച്വൽ ആയിട്ടാണ് മാറിയിട്ടുള്ളത്.
അതെ, that's what I told you, right? There are so many girls where by birth hymen ഉണ്ടാവില്ല, or it might have ruptured because of any other reason also, and you need not bleed every time a hymen ruptures. It's a very thin hymen, blood ഉണ്ടാവണമെന്നില്ല. That is one more thing. And more so, I want to stop this taboo by not educating females but educating the males, to be precise, because അവരാണ് ഇതിനെ ഉദ്ദേശിക്കുന്നത്. എൻ്റെ ഭാര്യ ഇല്ല, എൻ്റെ വൈഫ് ബ്ലീഡ് ചെയ്തിട്ടില്ല, ഇല്ല ഒരു മെംബ്രെയിൻ ഉണ്ടായിട്ടില്ല. സോ ഇറ്റ് ഈസ് മെയിൽസ് ഹു ഹാവ് ടു ബി എഡ്യൂക്കേറ്റഡ് ആൻഡ് ദി ബോയ്സ് ഹു ഹാവ് ടു ബി ടോൾഡ് that there is nothing, there is no hard and fast rule that they have to bleed. There is no hard and fast rule that a hymen has to be there, in every girl. So that is what every person needs to know. Be it be parents, be it be the marrying person.
Do men still understand the case? കാര്യം ആളുകളോട് ഇത് പറഞ്ഞ് മനസ്സിലാക്കുമ്പം ഇത് ഏറ്റവും കൂടുതൽ ബാധിക്കുന്ന പുരുഷന്മാരാണെന്നല്ലേ പറഞ്ഞത്. അവർ പറയുമ്പോൾ മനസ്സിലാവുന്നില്ല എന്ന് പലപ്പോഴും തോന്നിയിട്ടുണ്ടോ?
എനിക്കങ്ങനെ മെയിൽസ് ആയിട്ട് ഇതുവരെ വന്നിട്ടില്ല. ഇറ്റ്സ് ദി പേരന്റ് ഹു ബ്രിങ്സ് ദി ഗേൾസ്. മെയിൽസ് പെർസ്പെക്റ്റീവ്, ഐ തിങ്ക് യു ആർ എ ബെറ്റർ പേഴ്സൺ ടു ടെൽ, അഭിഷേക്. Because as a doctor, as a gynecologist, we come across girls coming into us or girls with their parents coming into us, and very rarely, as a fiance, as a husband bringing in. At least to a gynecologist, they don't. They might go to a quack or something like that, but very rarely they come. They have that boldness to come to us, probably.
What is your opinion on the 2-finger test about virginity?
I don't know. This is something. Probably what you mean is a 2-finger penetrate ചെയ്യാൻ പറ്റുന്നുണ്ടാണെങ്കിൽ she is not a virgin. That's what you mean to tell? Again a social myth, I can call.
അല്ല, ആ നിയമം ഇപ്പം എടുത്ത് മാറ്റിയില്ലേ ഒരു 4 വർഷം മുന്നേ?
That's what I'm trying to tell you, Abhishek. This is something called a myth. So 2-finger, normally a vagina can insert a 2-finger. But if it is post-delivery, it will be much more than a 2-finger. So when we are in a cosmetic gynaec, you were asking about treatments also, right? So one of the surgical treatment is vaginal tightening surgery, or vaginoplasty is what we call. So that is what we, sometimes after delivery, 2 deliveries, 3 deliveries, 4 deliveries, 5 deliveries, or n number of deliveries, the vagina gets lax, and that's when we bring it back to a 2-finger vagina, which means that it is a pre-pregnancy or a pre-delivery vagina. Okay, so in that way, what you're telling for a virginity 2-finger test is a total myth. Do not follow is what I want to tell you.
Is it possible to reconstruct the hymen?
Yeah, we do have a medical thing that we can reconstruct a hymen. But hymenoplasty is what we time, hymenography, hymenoplasty, hymenal reconstruction, that's there. We do have a surgical procedure for reconstructing the hymen.
Why is it still happening?
For the same myth, I can call it as, or sometimes for a genuine reason. Like they already know that she is married, and unfortunately they have separated as a first marriage, and they want to get remarried, and he or she, in our terms it's more so she is getting remarried, and the other person also knows about it, but they are aware of it, and they want to relive the first intercourse. They want to feel that. In that way, when they come asking for a treatment, we don't negate a treatment. So that is when we do oblige for a hymenoplasty, hymen reconstruction procedure. And sometimes along with vaginoplasty post childbirth, even though they're not getting remarried, it's with the same person, we sometimes do reconstruct a vagina and reconstruct a hymen also as a combined procedure. We do a surgical reconstruction for that.
Is it a surgically complicated treatment?
I cannot tell it's a complicated treatment, but yes, it's a surgical treatment where sutures are kept, anesthesia is required, but it's a day care procedure with a local anesthesia if she's comfortable, or if not, it's a short sedative or a short general anesthesia is what we give, but it's a day care procedure. She can walk back home the same day if it's just an hymenoplasty.
So can I ask you something really personal? From your side, are you really supporting hymenoplasty surgeries?
See, me being a doctor, I sit in this position to treat patients. If it comes to me in an obligatory way that a person comes to me and get her hymen repaired, probably I will not be doing that procedure. But if you come to me as a person who intends to do, like a patient, a girl walks in and who is wanting to get an hymen repaired, then I will oblige to the patient. It depends on what is the indication for the hymenal reconstruction. But being a doctor, as I told you, as my first tension, I'm not there to judge you. I am there to provide treatment to you. You ask me the treatment. If it is surgically right to do, then I will be doing that procedure. Then yes, we do hymenoplasties. Like I do hymenoplasties.
So you were talking about the vaginal tightening, right?
Yeah.
So what are the treatments available in India related to the vaginal tightening?
Vaginal tightening, we do have non-surgical and surgical. Like without surgery also, vaginal tightening can be done, and there are surgical options also. And more so at this age group, they do ask for vaginal rejuvenation also. Okay, and vaginal tightening and vaginal rejuvenation somehow goes hand in hand kind of a thing, because ഇപ്പോൾ vaginal laxity ആയിട്ടുള്ള ആൾക്കാർ പ്രസവിച്ച ശേഷം ആയിരിക്കും vaginal laxity ആവുന്നത്. അതിൻ്റെ കൂടെ vaginal rejuvenation means vaginal burning sensation ഉണ്ടാവും, ഇല്ല ചിലപ്പോൾ dryness ആവാനുള്ള സാധ്യത ഉണ്ടാവും. So ഇതിൻ്റെ vaginal rejuvenation is purely done by laser vaginal rejuvenation. Okay, lasers, we do have laser machines and laser treatment options, which is done like it's a OPD procedure, daycare procedure, where cuts and undavilla, sutures and undavilla. We don't use any knives and everything. So just laser in the valila, we put the laser into the vaginal area and we rejuvenate that part. In the sense, how we have facial rejuvenation, how we have mental rejuvenation. Basically, we are rejuvenating that part and giving increased blood supply to that area. Okay, and now coming to vaginal tightening was your question. Vaginal tightening also has two headings there, that is non-surgical and surgical. Non-surgical, we have laser vaginal tightening, that is laser വെച്ചിട്ട് നമ്മൾ യോനി ഭാഗത്തിന് ടൈറ്റ് ആക്കി കൊടുക്കാനുള്ള ഒരു ഓപ്ഷൻ ഉണ്ട്. ആൻഡ് ദാറ്റ് ഈസ് ബേസിക്കലി കൊളാജൻ റീമോഡ്യൂൾ ചെയ്യണതാണ് laser vaginal tightening is, and that we usually recommend for people who want vaginal tightening in between pregnancies. ഫാമിലി കംപ്ലീറ്റ് ആയിട്ടില്ല എങ്കിൽ വെജൈനൽ ലാക്സിറ്റി ഉണ്ട്, കുറച്ചും കൂടി ടൈറ്റായിട്ട് കിട്ടണമെന്നുള്ള ആൾക്കാരന് നമ്മൾ ലേസറായിട്ട് പറയൂ. അവർക്ക് യൂഷ്വലി ചിലപ്പോഴേ സർജറി പറയൂ. യൂഷ്വലി വി ഡോണ്ട് റെക്കമെൻഡ് സർജറി ഫോർ എ പേഴ്സൺ ഓർ എ കപ്പിൾ ഹൂസ് ഫാമിലി ഈസ് നോട്ട് കംപ്ലീറ്റഡ്. Okay, so we advise laser vaginal tightening, and for some patients whom laxity is to a mild to moderate, also we tell laser vaginal tightening. Surgical is for such patients who have quite a bit of laxity. Sometimes vaginal laxity അല്ലാതെ അവർക്ക് മൂത്രസഞ്ചിയും കുറച്ചും കൂടി താഴെ വന്നിട്ടുണ്ടാവും. നമ്മുടെ രക്തം വന്ന പറയൂ പുറത്ത് പോകാനുള്ള സ്ഥലം അതും കുറച്ചും കൂടി ഒരു പ്രൊലാപ്സ് ആയിട്ട് വന്നിട്ടുണ്ടാവും. റെക്ടോസീൽ ഇസ് വാട്ട് വി കോൾ മെഡിക്കലി. സോ ഈ രണ്ട് രീതിയിലും നമുക്ക് ഒരു പെത്തോളജീസ് കണ്ടെത്തിയിട്ടുണ്ടാണെങ്കിൽ അതിന് ഈ കറക്ഷൻ ഒരുമിച്ച് ചെയ്യൂ. ദാറ്റ്സ് വെൻ വി ഡു റെക്കമെൻഡ് സർജിക്കൽ വെജൈനൽ ടൈറ്റനിങ്. So these are the two options which are available for vaginal tightening, that is laser vaginal tightening, and surgical correction is what is recommended.
Why vagina need to be get tightened?
See, why vagina has to be tightened is there are two reasons for it. One is for the how can I put it, like as a couple they will not be having the same sexual gratification or satisfaction as prior because the vagina has got laxed. It's kind of, I cannot put it as cosmetic, but I can put it as more sexual discomfort or dysfunction. That is one of the reason. Another reason vaginal laxity, vaginal tightening is because, as I told you, there might be changes of bladder coming down, mutrasanchi tale erangittundavu illa kodalinde part, that is rectum, ഒരു റെക്ടോസീലായിട്ട് ഉള്ളിലേക്ക് കയറിയിട്ടുണ്ടാവും. സോ ഇത് ബുദ്ധിമുട്ടായിട്ടുണ്ടാവും പേഷ്യൻസിനെ. അങ്ങനെയും അവർ വരാറുണ്ട്. ദാറ്റ് ടൈം ഇറ്റ് ബിക്കംസ് മോർ ഓഫ് എ റീകൺസ്ട്രക്റ്റീവ് പ്രൊസീജിയർ ദാൻ വെജൈനോപ്ലാസ്റ്റി. ഇറ്റ് ബിക്കംസ് മോർ ഓഫ് എ മെഡിക്കൽ റിലേറ്റഡ് അപ്പോൾ നമ്മളായിട്ട് റെക്കമെൻഡ് ചെയ്യൂ you need to have cystocele repair or rectocele repair. Okay, these are the indications for vaginal tightening surgery. Coming to the cause, endina ee vaginal lax avunanulla samayathil, I mean if you ask me that, so that is more of like vagina is a elastic organ. Okay, it's for an example, it's like a rubber band itself. You can imagine ഒരു ചൈൽഡ് ബർത്ത് അവിടെ നിന്ന് നടക്കുന്നുണ്ട് പറഞ്ഞാൽ ഒരു കുഞ്ഞി ഈസ് കമ്മിങ് ഔട്ട് ഓഫ് ഇറ്റ് വിച്ച് ഇസ് ഓൾമോസ്റ്റ് 2.5-3 kgsന്റെ ഒരു ബേബി ഈസ് കമ്മിങ് ഔട്ട് മീൻസ് വെജൈന ഈസ് ഗെറ്റിംഗ് distended or stretched to that much of an extent. Yeah, so probably vagina will get back, definitely it will get back, but not to an extent that it was in the pre-delivery state. ഓക്കെ, സോ അങ്ങനെയുള്ള സമയത്തിൽ പ്രോബബ്ലി ദറ്റ് ലാക്സിറ്റി കുറച്ചും കൂടി ബാക്കിയാവും. സോ കുറച്ചും കൂടി ലാക്സ് ആവും. സോ ഇവൻച്വലി ആഫ്റ്റർ 2 to 3 ചൈൽഡ് ബർത്ത് കുറച്ചും കൂടി ലാക്സിറ്റി കൂടി പോകും. ദാറ്റ് ഈസ് വൺ തിങ്. വൺ മോർ തിങ്, വെജൈനൽ ബർത്ത് ഇല്ല ആണെങ്കിലും ദി ഹോൾ പ്രഗ്നൻസി ഇറ്റ് സെൽഫ്, ദി പെരീനിയൽ മസിൽസ്, the whole weight of the pregnancy is borne by the perineal muscles. So അങ്ങനെ ഉള്ള സമയത്തിൽ perineal muscle laxity is also one of the concerns. Okay, so that is an added on thing. And as the age, female aging ആവുമ്പോൾ as a collagen reduces from the body, anywhere of the body, wrinkling is a normal aging form of aging, what is seen. Same way collagen in every part of the body reduces, even in the vaginal mucosa. So അങ്ങനെ ആകുമ്പോഴത്തേക്ക് അതിൻ്റെ എലാസ്റ്റിസിറ്റി കുറവാകും. സോ ഇതെല്ലാ റീസൺസ് ആണ് വെജൈനൽ ലാക്സിറ്റി ഇല്ല വെജൈനൽ ചേഞ്ചസ് ആവണത്. ഓക്കെ, സോ ദാറ്റ് ഈസ് ദി cause of vaginal laxity.
So correct me if I am wrong. So you are talking about vagina, which is a muscular tissue.
It is a kind of mucosal tissue which is supported by paravaginal muscles.
So apart from the surgical and the non-surgical treatments, വേറെ എന്തൊക്കെ ഓപ്ഷൻസ് ഉണ്ട് നമുക്ക് ഈ വജൈനൽ ഇലാസ്റ്റിസിറ്റിയെ ഹോൾഡ് ചെയ്യാനായിട്ട്?
See, as you rightly asked, actually, vagina is supported by a lot of muscles. Okay, so you must have heard something about Kegels exercise. Kegels exercise is, you must have heard about various other exercises, അല്ലേ? സോ അതേപോലെ പെരീനിയം പറഞ്ഞാൽ വെജൈനൻ്റെ അടുത്ത് കുറേ മസിൽസ് ഉണ്ടാവും. സോ ആ മസിൽസിനെ സ്ട്രെങ്തൻ ചെയ്യാനുള്ളത് വൺ ഓഫ് ദി മോസ്റ്റ് എഫക്റ്റീവ് എക്സസൈസ് ഈസ് ദി Kegels exercise. Okay, and it is a very underrated exercise, to be frank, because it has a lot of benefits. And നമ്മൾ യൂഷ്വലി പറയാറുള്ളത് ഈ Kegel exercise നമ്മുടെ വെജൈനൽ ടൈറ്റനിങ്ങൾക്ക് മാത്രമല്ല, പോസ്റ്റ് ഡെലിവറി വാട്ട് എവർ മസിൽ ലാക്സിറ്റി ആയിട്ടുണ്ടാവും അതിനെ എല്ലാം റിക്കവർ ചെയ്യാൻ ആസ് എ പ്രിവെൻറ്റീവ് മെഷറും നമ്മൾ Kegel exercise പോസ്റ്റ് ഡെലിവറി പറയാറുണ്ട്. Okay, so Kegel exercise is very, very important, and you have to start doing from your third trimester of your pregnancy itself. So Kegel's exercise is, as you exercise any part, any muscle, other muscles, other muscles of your body, same way perineal muscles ne tighten akana help avu, and preventing vaginal laxity also. And now there is another newer technology which has come, that is high intensity focused electromagnetic waves. So idu nammada oru chair formula or motor vechittu varum. So that if you have to, you can sit on a chair which is pre-motorized, and avade electromagnetic waves varum, and that will contract your perineal muscles. Okay, and this will cause supramaximal contractions of those perineal muscles. So it is more effective than a normal Kegels. Okay, so basically already laxity ulla alkarla we do combined therapies sometimes, laser vaginal tightening along with electromagnetic waves nammal chair il irikkan parayu, so that muscles onnum koodi strengthen avu. So this is also available.
Oh, it's same as electromagnetic stimulation exercises. ഒരു പേഷ്യന്റ് വജൈനൽ ടൈറ്റനിങ്ങിന് വേണ്ടിയുള്ള പ്രൊസീജിയർ കഴിഞ്ഞിട്ട് will it affect their sexual life?
Yes, it will affect, but in a nice way. Because we are doing vaginoplasty, something we are redoing or recreating which was there prior to her deliveries. The initial stages of her marriage, when she was active sexually at the initial part of her life. So we are trying to create a vagina, depends on their indication definitely, but we would have created a vagina. That's when your 2-finger vagina is what we call. We minimize the vaginal diameter to a 2-finger width. Okay, so definitely they will be more satisfied with their, as a couple. So it will definitely help.
So how long does the result last, the vaginal tightening, after the procedure?
So for this, I will have to again divide your question into surgical and non-surgical. When we are doing a surgical vaginoplasty, surgical tightening, so that is almost a permanent result, okay? Because we are reconstructive and cutting through the tissues and resuturing it and getting your vagina back to a pre-delivery state. Unless you deliver again, your results is going to be permanent, okay? But whereas when you're going to a more of a laser vaginal tightening, that is going to be, we cannot tell it as a permanent procedure, but it is like a session-wise procedure. We tell monthly one session, and sometimes they will also require a touch-up session. Eventually, probably once in a year, once in 1.5 years, depending on their laxity.
So what will be the most probable side effects from the procedure?
You mean laser or you mean surgical?
I mean laser, and for the surgical ones?
Laser usually doesn't come with any much side effects. It's a very, daycare procedure, lunch break procedure, we also call it as. Usually side effects are almost nil, unless you're not in the right hand and laser settings is not fine, and you might end up having a burn down there. Other than that, if you're in the right hands, in the right cosmetic gynecologist, then you, almost nil I can call in a laser. But whereas coming to surgical procedure, again, if you're in the right hands, your complications are, almost nil. But as a surgeon, we do explain all the positives and negatives. If you come under a knife, whatever said and done, any surgery for that matter will have its own effects and side effects, okay? So whenever you are having an incision, you might end up having a blood loss. You might end up having an infection. You might end up having a nearby organ damage. This is the part in the surgery cheyidalo parayarundo. So that holds same for the surgery also. Other than that, there are no much side effects.
Is it possible to have a child after vaginal tightening?
So we can have a childbirth again, but we have to be aware that we have tightened an area. So we'll have to give an adequate gap between the pregnancies. And also and it is really recommended, we do not tell them to go under a knife before completing their family. Okay, because again vagina is going to get lax and again she'll come back with the same complaint. So we usually tell them, do not prefer that. But yeah, there are some patients who ask for it. Then we tell them that you can have a childbirth, but give adequate 2 to 3 years gap, probably minimum of that much, for a proper vaginal healing before you have a plan to have a childbirth.
One interesting term which I had gone through while doing the research for the cosmetic gynecology is Barbie vagina. So am I telling it in a right way?
Yes, probably. Yes, probably in the sense more of in a social media you can put it as, because we do get patients sometimes.
Okay. So what is Barbie vagina?
Yeah, Barbie vagina is something which is picturized vagina where, being precise about the anatomy of there's something called labia majora and labia minora. So the majora is something which is outside the minora, and that will be at the same level, or the minora goes inside the majora. So this is more of the Barbie doll vagina. So it is more of, that kind of a concept which is coming up now because of the social media. And same way have you put, you did your homework in the I suppose in the Google or on the media in that way. So those are the terms what we are seeing more online than offline. But seeing online, patients do come to us asking for it. Vaginoplasty, labiaplasty, combined procedures. We can be able to give her a Barbie vagina.
So what is exactly happening at that time?
There, one added on procedure is the labiaplasty there. See, vaginoplasty is anyways there, what we all discussed, more of a surgical. Labiaplasty is the more external surgery. What we see, vagina was the inside, the part of the, throughout the vaginal canal we are tightening it and giving it. But labia majoroplasty and minoroplasty is more outward appearance of the external genitalia. And starting from the majora and minora, there are two organs. Starting from the majora, we do sometimes plump up, like how we have facial fillers, like lip fillers, facial fillers. Same way we do have labial fillers, either with a filler or a fat grafting, autologous, patient's own fat. We fill up the labia majora and we make it a little more plumpier, depending on the age group of the patient, depending on the need of the patient. So we plump up the labia majora and we reduce the labia minora. Sometimes cosmetically, one will be longer, one will be shorter, discrepancy will be there. Sometimes both will be too long enough, and there might be functional concerns, depending on sexual, in terms of sexuality also. So in these patients also, we do a minoroplasty. So that is one of the other indication of minoroplasty. Coming back to labia, Barbie doll vagina. So labia majora is plumping up, labia minora is reducing the labia minora and trimming and making both the sides equal and combining with the vaginoplasty.
So what is the exact benefit for having this procedure in a sex life?
That is totally, it is cosmetic also. Again, it is the appearance, how they want. And some people, it might not be sexually, it might be only cosmetically. They are into, modeling field, or they are into, want to wear tight clothes, or they are into more exposing field where they want to look beautiful inside out. Okay, so in such patients, in such girls, it will be a boon. Such, because they would have also fantasized about it, or they would have also, people would have told them, or they have their group of friends, they are discussing about it. It is more so cosmetically in such group of girls or such group of individuals. And sometimes it comes to sexual satisfaction also when it comes to couples. In an older age group, sometimes they do come to us that they want these kind of things, and it becomes more of a sexual satisfaction there. So both the indications has to be respected.
Will that affect their sex life?
Not really. It is going to get benefited, as I can tell.
Okay.
Because we are not going to harm any organ there. We are only reconstructive and beautifying the part.
Yeah, but as of my knowledge, putting fillers will reduce the sensations, right?
No, not really. It won't reduce the sensations. Okay, and more so for labial fillers, we do have fillers and we do have fat grafting also. And me being into that field, I would prefer a fat grafting, which is more kind of a more permanent than a labial filler. But yes, labial filler, I have done labial fillers also, because labial fillers will stay for a year or two. But fat grafting is more kind of a more permanent, and it is your own filler, your own part of part of your body. You're taking out fat from one part and injecting into the other part. Okay, no, sensation is not going to get affected. Probably a few months, because the fat has to get accepted there and the fillers have to get accepted there. But majorly, it is not going to affect too much of the sensation.
Can you please explain me the fat grabbing procedures, exactly what is happening?
Okay, fat grafting is nothing but taking out patient's own fat from a dependent part of the body. Like in girls, it will be usually lower abdomen or inner part of the thigh. From there, we do take out the fat, process it, cut down the fat lobules, which are quite thicker, and then we inject into the desired part. Here it is labia majora, or if required in Mons area also, depending on the indications of the patients, and we inject into that particular area and we bulk up that area. So it is basically acts like a filler, but it is a patient's own part. So reactions are less, side effects are less, and it is more long lasting than a filler, than a HA filler.
Okay. What is exactly perineoplasty?
Perineoplasty is something, vaginoplasty, what I was telling was inside, and then we came up to labia, that is outer appearance, and then perineum is an area between the vagina and the anal opening. സോ ആ ഒരു മിഡിലുള്ള പാർട്ടിക്കാണ് നമ്മൾ പെരീനിയം എന്ന് പറയുന്നത്. സോ ഈ പെരീനിയം നമ്മൾ പ്രസവിച്ച ശേഷം എപ്പിസിയോട്ടമി വൂണ്ട് കൊടുത്തിട്ടുണ്ടാവും. സോ ആ ടൈമിൽ ആ പെരീനിയമിൻ്റെ വിടുത്ത് വളരെ കുറവായിട്ടുണ്ടാവും, ഇല്ല അതിൻ്റെ അപ്പിയറൻസ് ബുദ്ധിമുട്ടായിട്ടുണ്ടാവും, ഇല്ല സ്കാറിങ് ആയിട്ടുണ്ടാവും. സോ ഇതിനെ നമ്മൾ കുറച്ചും കൂടി ഭംഗിയായിട്ട് ചെയ്ത് we do a little more of a kind of a plastic surgery. We do more aesthetically better, and also we bring up ഒരു ലിഗമെന്റ് ഉണ്ടാവും. സോ അതിനെ കുറച്ചും കൂടി അടുപ്പിച്ച് കൊണ്ടുവരും. സോ പെരീനിയൽ ടൈറ്റനിങ് ഉണ്ടാവും, പ്ലസ് പെരീനിയൽ ബോഡീനെ നമ്മൾ കുറച്ചും കൂടി വിടുത്തായിട്ട് തരും. സോ ഇറ്റ് ഈസ് മോർ ഓഫ് എ സർജിക്കൽ പ്രൊസീജിയർ.
So most of the cases are happening exactly after childbirth. Am I right?
Yeah, most of these things are commonly, basically all these things, vaginal laxity, rejuvenation, burning sensation and all that. It's mid-age to post-childbirth.
What is exactly happening to a woman after childbirth?
This is a very vague question to be, നമ്മൾ വെജൈനത്തിൻ്റെ ഡിസ്കഷൻ എനിവേസ് ചെയ്തു. വെജൈനൽ ലാക്സിറ്റി ഉണ്ടാവും, and perineal muscle laxity vero. So these two things we have already discussed. And sometimes they will have a difference in the sexual complaints also. Okay, our arousal, orgasmic disorders veranu madi. Okay, this is more of a gynecological complaints. Okay, then we do have other body changes other than pure gynecological complaints, that is breast changes veranu madi, breast sagginess avanu madi, or breast size kudanu madi. Okay, and then you have abdomen you stretch avarundu, and basically body as a female they start gaining weight post pregnancy. Okay, so arms inde aayirikku fat accumulation avan thodungu, arm inde fat accumulation aayirikku, thighs inde fat accumulation, abdomen fat accumulation, abdomen skin laxity verum. So these are breast changes, abdomen changes, arms, axillary breast veranu madi, axillary pad of fat veranu madi. So these are the different changes what we come across in a post delivered female, and even stretch marks and avarundu. So in any part of the body, not only on the abdomen, arms la irikku, thighs la irikku, buttocks la irikku. So there are stretch marks can happen everywhere wherever the skin is stretched. So buttocks inde changes chala patients and avarundu. Yeah.
Are we able to increase the orgasm of a woman after childbirth?
Yes, we do have treatments for that. Regenerative therapies aayittu vararundu, because clitoris is one of the organ which is responsible for orgasm, and we do increase blood supply to that particular organ by giving PRP shots or regenerative therapies there. So there are treatments for that, and there is laser treatments also available to increase the orgasm.
ശരിക്കും എന്താണ് ആ ട്രീറ്റ്മെന്റ്? വാട്ട് ഈസ് എക്സാക്ട്ലി ഹാപ്പനിങ്?
So basically what happens is arousal or orgasmic disorders can be primary also, can be happening after childbirth also. Basically nerve supply illa blood supply to that particular organ, G-spot aayirikku, clitoris aayirikku, koravavan thodangu. So aa oru denervation illa neovascularization vascularization koravayadu we do give PRP therapies there, so that avidathe blood supply increase avate, avidathe neural supply also increases. So it is basically a monthly approach. Sometimes laser aayittu, vaginal rejuvenation aayittu, it's a part of that where G-spot is targeted. Avidathe blood supply increase akana, and even PRP sometimes we do inject over there. Patient's own blood ne eduthittu nammal oru platelet concentrate ne eduthittu adane inject aaki kodukku to those particular areas where we do get vaginal orgasms and clitoral orgasms. So idana more medical reethil nammal approach cheyanadu. So that again comes as session wise treatments, and obviously sometimes we do add on medical treatments also, depending on patient to patient, depending on their complaints.
So what are the different type of breast treatments available in cosmetic gynecology?
So I won't put it as only cosmetic gynac. When it comes to breast complaints, we do tackle them, because most of the gynecologists, most of the cosmetic gynecologists are as of now females. So we do get those patients, but anatomically we are not the person who handle alone. We do take help of holistic approach of a plastic surgeon also. But yes, we do come across breast sagginess, breast size has reduced, or we have patients equally on the opposite side, that breast has become more heavier after feeding, after so many pregnancies. So both the patients we do come across. So in that way, we do both kind of treatments there. Breast reduction also, breast augmentation also.
ഇന്ത്യയിലെ സ്ത്രീകൾക്കിടയിൽ വളരെ കോമൺ ആയിട്ട് കാണുന്ന ഒരു പ്രശ്നമാണ് SUI എന്ന് പറയുന്നത്. ചുമയ്ക്കുമ്പോഴോ അല്ലെങ്കിൽ തുമ്മുമ്പോഴോ അങ്ങനെയൊക്കെ വരുമ്പോൾ യൂറിൻ ലീക്ക് ആവുക, അങ്ങനെയുള്ള ഇഷ്യൂസ്. ഈവൻ സ്റ്റഡീസ് പറയുന്നത് സ്പോർട്സ് വുമണിലും അറൌണ്ട് 15 to 30 ഇയേഴ്സിലും ഇതിൻ്റെ പ്രിവലൻസ് റേറ്റ് കൂടുന്നതാണ്. സോ വൈ ഈസ് ദാറ്റ് ഹാപ്പനിങ്? ഈസ് ദെയർ എനി ട്രീറ്റ്മെൻറ്റ് ഫോർ ദാറ്റ്?
Yeah, what you said is right, but ഇത് പ്രശ്നമായിട്ട് കൂടുന്നില്ല, ബട്ട് അതിനെ മനസ്സിലാക്കിയുള്ള ഒരു അവയർനെസ് കൂടുന്നുണ്ട്. ബിക്കോസ് മുമ്പെല്ലാം അമ്മച്ചിമാരൊക്കെ ഉള്ള ആ ഒരു ഏജ് ഗ്രൂപ്പിൽ, ഇഫ് യു ആസ്ക് എനി അമ്മച്ചി എന്ന് പറയാനാവില്ല, മോർ ദൻ 45 ഇയേഴ്സ് ഏജ് ഗ്രൂപ്പ്, മിഡ് ഫീമെയിലിൽ, ഇഫ് യു ആസ്ക് മോസ്റ്റ് ഓഫ് ദെം, ഒരു 80 to 90% ആൾക്കാരനെ ചോദിച്ചാൽ ചുമയ്ക്കുമ്പോഴും തുമ്മുമ്പോഴും മൂത്ര പോകുന്നു എന്ന് പറഞ്ഞാൽ ചില പേഷ്യൻസിനെ അധികം ഉണ്ടാവും, ചില പേഷ്യൻസിനെ കുറവുണ്ടാവും, ബട്ട് ദിയർ ആൻസർ വിൽ ബി ചിലപ്പോൾ പോവാറുണ്ട്. സോ ഇറ്റ് ഈസ് ജസ്റ്റ് ദാറ്റ് ദേ ആർ ഗെറ്റിംഗ് അഡ്ജസ്റ്റഡ് വിത്ത് ഇറ്റ് ആൻഡ് ഗോയിങ്. ഓക്കെ, ആൻഡ് വൺ മോർ റീസൺ ഇപ്പോൾ കൂടുന്നുണ്ടോ ഈ സ്പോർട്സിൽ തന്നെ ഉള്ള ദി വേ യു ടോൾഡ് ആ റിസർച്ച് വർക്ക് കൂടുന്നത്, മുമ്പ് പെണ്ണുകൾ ഇത്ര സ്പോർട്സിൽ ഉണ്ടായിട്ടില്ല. ഇപ്പോഴാണ് ഫീമെയിൽസ് ആർ ഗെറ്റിംഗ് ദാറ്റ് ഫ്രീഡം ഓഫ് ഗോയിങ് ഔട്ട് ആൻഡ് ലിവിങ് ദിയർ ഡ്രീം. ആൻഡ് വൺസ് ദേ ആർ ഗോയിങ് ഔട്ട്, ദേ ആർ കമ്മിങ് അക്രോസ് ദീസ് കംപ്ലയിൻസ് വിച്ച് വാസ് ദെയർ. ഈ കംപ്ലയിൻസ് പൊതുവെ ഉണ്ടായിരുന്നു, അതിനെ നോട്ടീസ് ചെയ്യാൻ തുടങ്ങി, അതിനെ പറയാൻ തുടങ്ങി. People were adjusting with it and going. So ഇപ്പോൾ our quality of life is, our importance to the quality of life is coming up. And പറഞ്ഞ പോലെ people are, girls are going out to working, sportsലായിരിക്കും, gymnasticsലായിരിക്കും, people are going to gym also. And as I told you in the initial, that people are going to gym and working out for all the muscles, but they forget their perineal muscle. So perineal musclesന് സ്ട്രെങ്ത് കൊടുക്കുന്നത് വിട്ടു പോകുന്നുണ്ട്. സോ ഇതെല്ലാം റീസൺസ് ആണ് നമുക്ക് SUI കുറച്ചും കൂടി അധികമായിട്ട് ഇറ്റ് ഇസ് കമ്മിങ് ഓൺ ദി പേപ്പർ വർക്ക്, പേപ്പറിലോ ഹിസ്റ്ററിയിലോ ഇല്ല റിസർച്ച് വർക്കിൽ വരുന്നുണ്ട്.
Is the condition really curable?
Yes, curable ആണ് definitely. Till now SUIs, we do grade it. Mild ആണോ, moderate ആണോ, severe ആണോ എന്ന്. So in that way treatment options are available. So we do tell everybody, more than curable, I want to highlight the term that this is preventable. Okay, വരാത്ത പോലെ നമുക്കതിനെ ചെയ്യാൻ പറ്റൂ. That is what we all have to target on than curing something. Prevention is always better than cure. Okay, so അങ്ങനെ വെച്ചിട്ട് SUI is something which is preventable. As I kept telling that Kegels is a very underrated exercise. Kegels to a great extent helps in preventing stress urinary incontinence. Okay, നമുക്ക് മനസ്സിലാക്കാനുള്ളത് ഈ SUI വരാനുള്ള കാരണം, SUI is a bladder, ഒരു യൂറിനറി ബ്ലാഡറിൻ്റെ ഒരു പ്രശ്നമാണ്. പക്ഷെ since it is closely related to vaginal area, we as a gynecologist are handling it. But as a urologist also, stress urinary incontinence urologist doctors also handles it. But since it is related to vagina, we target it, and more so it is coming a little more on a cosmetic gynecological treatment wise, because we do have treatments, kind of laser treatments available for SUI. ഓക്കെ, സോ വെജൈനൽ ഏരിയ നമ്മൾ ടാർഗറ്റ് ചെയ്യുമ്പോൾ അതിൻ്റെ അടുത്തുള്ള സ്ട്രക്ചറാണ് യൂറിനറി ബ്ലാഡർ ഉള്ളത്. ഈ ചുമയ്ക്കുമ്പോൾ തുമ്മുമ്പോൾ പോകാനുള്ള മൂത്ര, ബിക്കോസ് നമ്മുടെ അബ്ഡോമിനിൻ്റെ പ്രഷർ കൂടുമ്പോൾ ബ്ലാഡർ ഇസ് നോട്ട് ഏബിൾ ടു മൂത്രനെ പിടിച്ച് വെക്കാനുള്ള ഒരു എബിലിറ്റി ഉണ്ടാവില്ല. സോ ഒരു വയറിൻ്റെ പ്രഷർ കൂടുമ്പോൾ ഇറ്റ് ഈസ് കമ്മിങ് ഔട്ട്. സോ വാട്ട് വി ഡു ഇസ് വി ടാർഗറ്റ് ദി ആംഗിൾ ചേഞ്ച് ബിറ്റ്വീൻ ദി ബ്ലാഡർ ആൻഡ് ദി യുറെത്ര. അതിനെ കുറച്ചും കൂടി പൊക്കി കൊടുക്കും. So if it is mild to moderate, Kegels exercise will be of great help along as a prevention. As a treatment option, Kegels along with that chair, what I told you, electromagnetic wave treatment. So adu nammal treatment ആയിട്ട് ഓപ്ഷൻ കൊടുക്കാറുണ്ട്. Okay, so these two are for mild to moderate. Kegels exercise along with supramaximal contractions of the EM chair. And we also combined either PRP or lasers. Okay, PRP regenerative therapies are also doing good for stress urinary incontinence, and some patients we do recommend lasers also as a treatment options for mild to moderate stress urinary incontinence. Now coming to severe form of stress incontinence, കുറേ ആയി ഇപ്പോൾ ചെറിയ ഒരു ചെറിയ ചുമയുണ്ടോ ഇല്ല ചെറുതായിട്ട് ചിരിച്ചാലും മൂത്ര പോകുന്നു എന്നുള്ള പേഷ്യൻസ് വരാറുണ്ട്. സോ അങ്ങനെയുള്ള ആൾക്കാരിനെ നമ്മൾ യൂഷ്വലി ലേസേഴ്സ് ഇല്ല, ഇങ്ങനെ നോൺ സർജിക്കൽ തെറപ്പി പറയാറില്ല, ബിക്കോസ് ദാറ്റ് മൈറ്റ് നോട്ട് ഹെൽപ്പ് ടു ഹെൽപ്പ് ദെം മച്ച്. സോ വി ഗോ ഫോർ എ സ്ലിംഗ് സർജറീസ്, സർജിക്കൽ കറക്ഷൻ പറയാറുണ്ട്. സോ ദാറ്റ് ബിക്കംസ് അണ്ടർ ദി നൈഫ് വിത്ത് അനസ്തീഷ്യ.
കറന്റ്ലി ജെൻഡർ ട്രാൻസ്ഫർ, അതായത് ഫ്രം മെൻ ടു വുമൺ ഓർ വുമൺ ടു മെൻ, ആസ് വി കോൾ ട്രാൻസ് മെൻ ഓർ ട്രാൻസ് വുമൺ, വളരെ ഫ്രീക്വന്റ് ആയിട്ട് ഇപ്പം റാപ്പിഡ്ലി നടന്നുകൊണ്ടിരിക്കുന്നതാണ്. ആൻഡ് as we all know, it's a complicated, long process. So as a cosmetic gynecologist, you will be a part of the procedures or for the whole journey. So എങ്ങനെയാണ് ആ ഒരു ട്രീറ്റ്മെന്റിനെ കാണുന്നത്? How complicated it is?
No, it is, to be frank, a complicated process തന്നെ, because gender changing surgeries is not just physical changing. There are a lot of other things which has to be changed in the body, because by a person, he wants to become a she or a she wants to become a he. So it is more kind of a mentally, mental, a lot of things which is getting involved. So angane vechittu there is a holistic approach here. As a gynecologist, we are a part of it. As a plastic surgeon is a part of it. Endocrinologist is a part of it, because hormonal changes kore reethil is required, and a psychologist or a psychiatrist if at all required. So this is a holistic approach which is required from all these departments. Okay, I cannot be more precise like it's a cosmetic gynecologist, but as a gynecologist itself, we are a part of it. Like for an hysterectomy or for all these gynecological complaints, we do come into picture. So we also are a part of these multiple procedures what they are undergoing.
ഇപ്പോൾ ഒരു 10 വർഷം മുന്നേ ഉള്ളതിനേക്കാളും ഇപ്പം എസ്തെറ്റിക്കലി അപ്പിയറിംഗ് ആക്കുന്ന രീതിയിൽ നമുക്ക് ഈ സർജറീസിനെ മാറ്റാനുള്ള ടെക്നോളജീസ് അവൈലബിൾ അല്ലേ?
Definitely. We are getting a lot of updates, like even in India, even in Kerala for that matter, we have approachable laser machines, internationally approved, FDA approved machines which has come down, and it is more ipo nammal export import better aayittundu, and research work is much better, regenerative therapies are much better. So a lot of advancements are happening, and same way patients are also being more aware of all these treatments. So as a medical treatment provider, we are also in a better way of providing up to the mark treatments. And as a patient also, I cannot call them as a patient, as a female, or as a female who are aesthetically or cosmetically more oriented, we are being able to meet their expectations also to a great realistic approach way.
മാഡം ഇത്രയും വർഷമായിട്ട് കോസ്മെറ്റിക് ഗൈനക്കോളജി പ്രാക്ടീസ് ചെയ്യുന്നു. പോൺ അഡിക്ഷൻ അല്ലെങ്കിൽ പോൺ കാരണം ആളുകളുടെ ചിന്താഗതിയിലുണ്ടായ മാറ്റങ്ങൾ, അതുകൊണ്ട് ആണ് പേഷ്യൻസിന്റെ മൈൻഡ് കുറച്ചുകൂടെ ഫ്ലക്ച്വേറ്റ് ആവുന്നത് എന്നൊക്കെ തോന്നിയിട്ടുണ്ടോ?
Yes, to a certain extent, yes. Sometimes as a couple, sometimes as a female herself, they do come, with that is what we term it as unrealistic approach. Like how ഒരു ഫേഷ്യൽ സർജറിക്ക് ഒരു ഹീറോയിൻ്റെ ഫോട്ടോ കൊണ്ടുവന്നിട്ട് നമുക്കിങ്ങനെ നോസ് ഇങ്ങനെ തന്നെ വേണം, ഇല്ല ഒരു മിഡ് ഫേസ് ഇങ്ങനെ തന്നെ വേണം, ജോ ലൈൻ ഇങ്ങനെ തന്നെ വേണം എന്ന് പറയാറുണ്ട്. സെയിം വേ പീപ്പിൾ ഗെറ്റ് ഇൻ ടു സോഷ്യൽ മീഡിയ. ഇറ്റ് മൈറ്റ് ബി പോൺ, ഇറ്റ് മൈറ്റ് ബി സോഷ്യൽ മീഡിയ, ഇറ്റ് മൈറ്റ് ബി Google photos which are available, there will be YouTube videos which are coming up. All these are hampering as a female appearance. People, young girls or mid age group girls do get influenced by these things, and they come to us asking for these things, like avade engane undairno namakku ingane venam angane parnittu vararundi. So it's always on the increasing trend, because accessibility to these things, like as you told, porn ആയിരിക്കും, social media ആയിരിക്കും, Insta videos, YouTube എല്ലാം കുറച്ചും കൂടി ബെറ്റർ ആയിട്ടുണ്ട്. accessibility to it is more easy nowadays. So in that way it affects a lot, even in cosmetic, even in sexual disorder or sexual dysfunction also. We do get a lot of patients with such concerns.
What is the future of cosmetic gynecology?
We are in the future is what I can tell you, because this question is coming up like since 5 to 10 years now. But yes, cosmetic gynec has still more a brighter future, because we do have over the period of 5 to 10 years we have seen tremendous growth in cosmetic gynec in terms of laser machines which is there, in terms of different types of lasers or energy based devices which has come up. So stem cell therapies വരുന്നുണ്ട്, exosomes are coming up for cosmetic gynec, so more regenerative therapies are coming. So these are the few newer things which are coming, and we are also lot of research works coming, loads of recommendations coming. So there's a lot of future for cosmetic gynec. As a department, I can call, as a doctor, as a patient wise, we are also happy that we are able to satisfy a girl's needs, or satisfy her complaints, whatever she's coming with.
Okay. What is the scariest treatment in cosmetic gynecologist?
Scariest treatment, is it? I will not put it as scariest treatment, because being a doctor, being a cosmetic gynecologist myself, I have been handling patients since quite a number of years now. So nothing scares me more than a couple coming and sitting here, as you rightly told the other question, seeing a porn or some other social media and coming and having an unrealistic approach. That scares me more than giving them a treatment. Convincing them that getting them down, this is what medically for her body what we can offer. So that is more scary, psychological counseling, than actually providing a treatment.
Someone will not be able to look exactly like a woman in the porn or a man in the porn, right?
See, everybody is different. Everybody cannot look like a Miss Universe or a Miss India. But yes, every girl, even in the genitalia wise, every genitalia is unique. Every genitalia has to be respected for that matter. So in that way, it is all about your acceptance. It's all about your need of transforming. So you need it, you transform it. Just because somebody else is looking like that, you need not be. Being a doctor, I would tell you that, as be yourself, and do not go in search of beauty. So you yourself is beautiful, and start accepting yourself as more beautiful. Okay, now don't go in search for it, because everybody cannot be like one person, and it's boring. And it's boring to look like one, look like the same everybody.
Exactly like same.
Exactly. So everybody in their individual way are beautiful.
So there is a separate branch or a department for cosmetic gynecology. But is there a separate branch or a department for cosmetic andrology? That is a cosmetic department for males?
Probably we'll see that as a future, not now, as of now. But we have a separate branch for gynecology, right? Like as a women's health. That's where this cosmetic gynecology has come up. There's no particular department as such. Andrology is a part of urology. So cosmetic wise, probably a dermatologist can handle. Functional wise, probably a urologist can handle. So somewhere in between, cosmetic andrology can come up in future. Let's see.
Is there a really need for that in India?
Being a gynecologist, it's difficult for me to answer. You are a better person for that to answer. Being a male, as a male need, But yes, we do get, I am a fertility specialist also, but we do get concerns from a male partner also of certain concerns. Sometimes we do take help of a plastic surgeon or a dermat, and sometimes urologist also. But most of a plastic surgeon is what I do take, because sexual dysfunction is more, when we come to a cosmetic gynec, as a female, when we are handling sexual dysfunction, their partner will also have a certain concerns. So, I cannot call it as a need, but people are handling it in their own different specialities. But there is concerns from the male, perspective also.
In future, we can expect that.
A separate department, yeah.
Do a woman really need a cosmetic gynecologist in any part of their life?
I will not tell they will need it, but if you ask me as a girl, as not as a doctor, but definitely as a girl, there will be a lot of changes in a girl's body. So respecting your body and giving it the right. See, I'm not telling cosmetically, but more so functionally. If there is any complaint functionally, do not compromise on your quality of life. Okay, so that is one thing. If at all any change is happening, definitely you have to reach out to a cosmetic gynecologist if that is the concern. But if you are into a preventive way, you might not need. Okay, if you are healthy enough, you might not need a cosmetic gynecologist. But it, again, as I told you, it all depends, beauty lies in the other's eyes, no? So in that way, if it's an internal beauty, it's about herself, how confident is she in her body. If she's not confident, it's not about the need or recommendation, it's about her confidence which matters, and she has to reach out. More so then I would tell that she needs a cosmetic gynecologist. And we are there to, cater all those complaints.
മംഗലാപുരത്ത് ബോൺ ആൻഡ് ബോട്ടപ്പ് ആയിട്ടുള്ള ഡോക്ടർ മലയാളം പഠിക്കാൻ പാടുണ്ടായിരുന്നോ?
For me, Malayalam എപ്പോഴും ഞാൻ മാംഗ്ലൂർ ഉള്ള സമയത്തിൽ I used to always feel it's like a tongue twister. ഞാൻ എപ്പോഴും ഇതിനെ പഠിക്കാനുണ്ട്, I mean for sure പറ്റൂല എന്ന് വിചാരിച്ചതാ. പിന്നെ I ended up marrying a Malayalam കാസർഗോഡ് പേഴ്സൺ. സോ ബുദ്ധിമുട്ടൊന്നും ഉണ്ടായിട്ടില്ല. പേഷ്യൻസിനെ കോൺവേഴ്സ് ചെയ്തിട്ട് പഠിച്ചു. പിന്നെ 1 year I was in മലപ്പുറം. സോ അവിടുത്തെ മലയാളം, കാസർഗോഡിൻ്റെ മലയാളം, കന്നഡ മിക്സ്ഡ് മലയാളം എല്ലാം മിക്സ് ആയിട്ടുണ്ട്.
മംഗലാപുരമുള്ള പേഷ്യൻസും കേരളത്തിലുള്ള പേഷ്യൻസും തമ്മിൽ വാസ്റ്റായി ചേഞ്ചസ് ഉണ്ടെന്ന് തോന്നിയിട്ടുണ്ടോ?
വാസ്റ്റായിട്ട് ചേഞ്ചസ് ഒന്നുമില്ല. ബട്ട് കാസർഗോഡ് ആൻഡ് മാംഗ്ലൂർ ലിറ്റിൽ ഡിഫറൻസ് ഉണ്ട്. മാംഗ്ലൂരിൽ ലിറ്റിൽ മോർ കോസ്മെറ്റിക്കലി ദേ ആർ ലിറ്റിൽ മോർ കൺസേൺഡ് ബിക്കോസ് ഇറ്റ്സ് കൈൻഡ് ഓഫ് എ സിറ്റി അല്ലേ. ഇപ്പോൾ കൊച്ചി മാംഗ്ലൂർ കമ്പയർ ചെയ്താൽ പ്രോബബ്ലി സെയിം ആയിരിക്കും. കാസർഗോഡ് മാംഗ്ലൂർ ചെയ്താൽ കുറച്ചും കൂടി ഡിഫറൻസ് വരുമായിരിക്കും. ഇപ്പോൾ ഹിയർ ഐ ഗെറ്റ് എ ലിറ്റിൽ മോർ ഓഫ് പെരീനിയൽ ഹെയർ റിഡക്ഷൻ കോസ്മെറ്റിക്കലി. But in Kasargod, I don't get cosmetically perineal hair reduction. Facial hair reduction, I get commonly everywhere. PCO site. But perineum and hair reduction cosmetically, just because I don't want, അവിടുത്തെ മുടി എനിക്ക് വേണ്ട, റേസർ യൂസ് ചെയ്യാനില്ല എന്നുള്ളത് കാസർഗോഡിൽ കുറച്ചും കൂടി കുറവാണ്. I tell them when there is recurrent folliculitis, കുറേ ആവുന്ന I recommend them that, ഇങ്ങനെ ചെയ്തോളൂ എന്ന്. പക്ഷെ മാംഗ്ലൂരിൽ അതൊരു ഡിഫറൻസ് ഉണ്ട്. കോസ്മെറ്റിക്കലി they are more oriented here.
Thank you so much for sharing your valuable insights.
Yeah, thank you. But എനിക്കറിയില്ല ഇത് എങ്ങനെ ആക്സെപ്റ്റബിൾ ആണെന്നാണ് സോഷ്യൽ മീഡിയ. ഐ ഡോണ്ട് നോ ഹൗ ഇറ്റ് വെന്റ്.
കുഴപ്പമില്ല, ഞാൻ പറഞ്ഞേ, ഞാനത് ഡോക്ടറിനോട് സംസാരിച്ചപ്പോഴും ആദ്യം പറഞ്ഞ പലരും സംസാരിക്കാൻ മടി കാണിക്കുന്ന ടാബു ആയിട്ടുള്ളൊരു ഡിപ്പാർട്ട്മെന്റ് ആണ് കോസ്മെറ്റിക് ഗൈനക്കോളജി എന്ന് പറയുന്നത്. സോ അത് ഇത്രയും ഓപ്പൺ അപ്പ് ആയിട്ട് നമുക്ക് പറഞ്ഞു തന്നതിനും, ആൻഡ് യു ആർ ദ വൺ ഓഫ് ദ ബെസ്റ്റ് കോസ്മെറ്റിക് ഗൈനക്കോളജിസ്റ്റ് ഇൻ കേരള.
I don't know, people put it as, yeah. Thank you. It was good discussing with you, Abhishek. Thank you so much.
Thank you, ma'am.